Imagine this. You walk into a busy cafe. The hum of conversation wraps around you. Someone glances your way. A barista smiles and asks for your order. Your heart pounds, but you don't break a sweat. You're not really there. You're standing in your room wearing a headset, surrounded by walls. And yet, somehow it feels real. What if exposure didn't require exposure? What if you could face your fears, not in the cold sharpness of real life, but in a space soft enough to hold you? This isn't science fiction. This is the quiet revolution of virtual reality therapy. We often think of VR as entertainment, a playground for games and escape. But what if it could also be a space of return? A space where you come back to yourself, not just as you are, but as who you're learning to become. Because here's the paradox that makes it all possible. VR is real enough to make your heart race, but safe enough to let you fail without consequence. That space, between fear and freedom, is where healing begins. You see, your brain doesn't care much about the source of input. It cares about pattern, reaction, meaning. So when you're sitting in a simulated meeting, surrounded by pixelated coworkers, your palms may still sweat, your chest may still tighten, your inner critic may still whisper. But here's the difference. You can take off the headset. You can try again tomorrow. You can pause, reflect, re-enter. And each time, the edges of fear soften just a little more. This isn't a flaw in the technology. It's the very thing that makes it powerful. VR lets therapists recreate, with eerie accuracy, the micro moments that trigger your anxiety. A raised eyebrow, an awkward pause, a spotlight on your face. They can tailor scenes, job interviews, first dates, group presentations, calibrated to your unique patterns of fear. This is exposure therapy with a level of precision we've never had before. No guesswork, no generic scripts, just real-time rewiring of how your brain perceives social threat. And what's more, it doesn't always require a therapist to be in the room with you. Sometimes they join you as avatars. Other times you're guided by an AI, trained to offer prompts, feedback, even encouragement. It's strange, isn't it? The idea that something synthetic might help you feel more human, but in a world that often leaves people waiting months for support, a therapist who logs in might just be enough. Still, we have to ask, can empathy be programmed? Can a bot ever truly understand what it means to be afraid to speak? Maybe not. But maybe it doesn't need to. Sometimes it's not about being understood. It's about having the space to explore, on your own terms, in your own time. For years, exposure therapy carried a weight of shame. Face your fear, they said. Push through. Get over it. But VR invites something gentler, less like confrontation, more like curiosity. It lets you play with fear like a child plays with shadows. You step forward, then back. You speak, then listen. You test the limits of your discomfort without judgment. Without real-world fallout. It's not a punishment. It's a practice. And for some, it even becomes a game. Apps now blend CBT, cognitive behavioral therapy, with quests, achievements, even rewards. You level up by holding eye contact. You earn points by initiating conversation. But here's the question. When does the game stop being helpful? When does it stop being therapy? Because while games are addictive, healing is not. And there's a fine line between motivation and masking, between progress and performance. We must be careful not to lose the heart of what matters most. Presence, connection, truth. Still, VR doesn't only change how patients see the world. It also changes how therapists see their patients. Imagine stepping into your client's world, feeling what they feel, seeing what shuts them down. This kind of reverse immersion, where therapist becomes the observer inside the storm, creates a deeper empathy. Not just clinical understanding, but felt, lived, sensory compassion. And that might be the most powerful shift of all. But then there's the reality we can't ignore. These headsets, these programs, they're not cheap. They assume access to tech, space, privacy. What about the teenager sharing a room with 3 siblings? What about the older adult in rural areas with no broadband? Is this future only for the privileged? Some projects are working to change that, bringing low-cost VR to schools, clinics, even refugee camps. But the gap is still there. And we have to ask, are we building a new path to healing, or just another digital gate? And even when VR works, what happens when you return to real life? Confidence in simulation doesn't always translate to confidence in the world. Sometimes you feel ready inside the headset, but step into a real crowd, and all that training evaporates. That's emotional lag, when your brain knows you're safe, but your body hasn't caught up yet. It's a reminder, VR is a bridge, not a destination. But maybe that's the beauty of it. Because more than anything, VR gives you a space to tell a new story. You're not just a patient. You're a player, an author, a creator of your own simulation. You can choose your avatar, how you look, how you sound, how you stand. You can write your narrative, scene by scene, setback by breakthrough. It's not pretend, it's rehearsal for the life you're trying to live. What if healing isn't about getting back to who you were, but discovering who you might be if fear wasn't holding the pen? In that way, VR becomes more than a tool. It becomes a mirror, but not the kind you avoid in the morning. The kind that shows you, not as you are, but as you could be. Calm, grounded, connected. What if that version of you isn't just virtual? What if it's already in there, waiting? You see, VR therapy isn't just about confronting anxiety. It's about rethinking reality itself. Challenging what's real, what's safe, and what it means to be whole. Because maybe the point isn't to be brave out there. In the noise, the glare, the gaze, maybe the point is to be brave in here first. In a space where you can fall apart, piece yourself back together, and step forward, again, and again, and again, until one day the cafe is real, the smile is real. The conversation, the connection, it all becomes part of the world you're no longer hiding from. Beyond the headset, a different kind of life waits for you. Not perfect, but possible.